Thank you.
Perfect. Thanks, Jared. All right, Lisa, well, to start, do you want to fill us in a little bit on your background? Obviously, like I said, the floor is all yours in this workout room and everything, so that's perfect. So I would love to hear a little bit about you and kind of some questions that we can start asking our managers here in a second, but let's hear about your background.
Okay, well, I graduated from Clarkson in 1988. I currently work the overnight shift in the emergency department, the freestanding ER on 24th and Cumming. I've started at St. Joe's in 1996, working ICU, PACU, OR. I've been an educator. I was QI in education for Bergen and for Creighton for many years. And I'm just kind of needing a little change in my life right now.
Yeah, well, that's perfect. So yeah, I mean, I think that's probably one of my favorite things about nursing for sure is that you have all the different opportunities to, go down so many different paths and everything. So I guess when you are kind of considering a change, what are some things that you're looking for?
I'm kind of needing to come off the overnight shift a little bit. I've done it for a long time. And I just need a different pace. I've been doing the ER thing for about 7 years now, I think. And I love the patient contact. I just am kind of looking for a little bit of a different patient contact, I guess you could say.
Sure. Well, good. Well, to start, we can have each one of our managers go ahead and kind of tell us a little bit an overview of how your patient population to start on each of your units, if that's okay.
That sounds good.
Perfect. Okay, let's start. I'll kind of see who's on my screen and designate from there. But Marcy, I have you first if you want to go ahead and start.
Sure. So again, I'm Marcy from the endoscopy lab. We're located on main campus, so on the 42nd and Dodge Street location. We have 4 procedure rooms. So our nurses it's kind of similar to an OR from an aspect, but not sterile. So our nurses learn the nurse role. They also learn the role in how to help the physician with the GI procedures. So we have 4 procedure rooms. In each procedure room, we have 2 staff members in the room. One of them is always a nurse. And so we do procedures from screening colonoscopies to upper endoscopies to ERCPs, EUSs, which is a way we can diagnose different cancers. And we're also doing a lot of new procedures that we are able to do endoscopically in preventing patients to go to the OR. So lots of innovative ideas that they are coming up with in the endoscopy realm.
Awesome. Thanks so much for sharing.
Yeah.
Nikki on my screen next, and then Nikki, you are with Emily. Is that correct? Perfect.
Yes, that's correct.
Tag team, you can do that if you would like to, or you can, whatever works best for you guys.
Well, I guess since I'm on mute. So me and Emily work on 6 Neuro, which is our neurological science med-surg unit. We are a 48-bed unit located in Clarkson Tower on the 6th floor. We take care of stroke patients, seizure patients, head, neck, and back surgeries. Since we are kind of a bigger unit, we also get like overflow from trauma, transplant, all that kind of good stuff. But our main focus is our strokes and our seizure patients. So yeah.
Awesome. Anything you want to add, Emily?
Yeah, Nikki covered it all. We do have a little 8-bed subspecialty unit for epilepsy, which is kind of cool. Our nurses like that a lot. We take patients off their seizure medications and induce seizures in them. That's always kind of fun for new nurses or any nurse to like look and see. Yeah, we're a fun unit.
Perfect. Thank you. Marla, I have you next.
Hello. So on the med-surg ortho floor, I'm located in the lead transplant center. So Nebraska Medicine has 4 different towers. So that's why we kind of say what tower we're working in, but it's all connected. My unit is med-surg ortho, so I would say right now with COVID, it does kind of wax and wane as far as how many orthos we actually get. But we're still probably about 30% orthos and 70% med-surg. Ortho patients, we always say, are kind of our breath of fresh air. They are planned surgeries, hips, knees, shoulders. We do a little bit of spine as well. They're very well educated. They're prepared when they come in. They know what to expect. They got lots of education pre-op and from the clinic. So just standard protocols, etc. The rest of the patient population is pretty much like any med-surg unit. We get anything and everything from the ED. We get transfers from ICUs. We get direct admits from neighboring towns. We also have some complicated orthos that we get here as well. Some of those surgeries or some of those traumas that other hospitals in smaller towns can't handle, they'll come to us. Or some of those infected joints that are here for a while, getting those joints removed and being on antibiotics, etc. So I always say it's a great place to work as far as things stay interesting. There's always something different every single day, always something new that you'll be seeing. It is fast-paced. Med-surg units, we tend to discharge and admit probably on average about 10 of our patients out of the 40. It is a 40-bed unit, so fast paced and the aspect of things just keep moving all day. So, but yeah, that's probably the gist of it anyway.
Perfect, thank you. And then I have Kelly next.
Hi, I manage that Neuro ICU, as I mentioned before. It's in Clarkson Tower on the main campus. We have 20 beds, and similar to our neuro floor, we take strokes, that's hemorrhagic or ischemic. We do epilepsy procedures and diagnostics, brain tumor removal, sometimes your general encephalopathy. While we don't have the highest acuity of all of the ICUs, we do have the highest turnover of patients. And so we're similar sometimes, many times, to our med-surg counterparts, where we can transfer 11 out of 20 in a day and get that many admissions. Anybody coming from the OR is a direct admission from the OR, so we recover them. And we are the only comprehensive stroke center in the region. So we do thrombectomies, coilings, clippings, you name it, we do it for the neuro patient.
Well, thank you guys all for sharing. Lisa, I want to pause a second. Do you have any questions for any of our nurse managers who just kind of gave an overview of their units?
No, I appreciate the information. I don't think I have any questions.
Perfect. Okay, well, I have a couple different other things that we'll go ahead and ask, and we have this for about 10 more minutes, just to give you guys kind of a heads up on time. So one of my favorite things I always like to ask managers about is culture. Obviously, you guys all know from working here, that culture is huge at Nebraska Medicine. So I wanted to go ahead and see if each one of you could tell me a little bit about what the culture is like on your unit. I'll kind of start same order and everything. So Marcy, I have you first if you want to go.
Yeah, so in procedural, it's a little bit different from the floor. And so I say the biggest difference from procedural to the inpatient units is you're working side by side with multidisciplinary team all day long. So in your procedure room, you're working side by side with that physician for 4 to 8 hours with that same physician, on top of anesthesia in the room, and also the other counterpart, whether it be another nurse or another tech in the room. So the culture is very teamwork oriented. And I would say our autonomy in our rooms is very, very high. So the physicians respect our opinion, we respect theirs. Same thing with anesthesia. It's kind of all hands on deck. We work together, continuously working for those patients. And so the biggest thing with our culture is there has to be a lot of teamwork and accountability, because there is a huge, just a huge teamwork aspect of everybody pulling together and getting those patients taken care of, because you have to be there. That patient's asleep, so you're speaking up for that patient continuously. And so really that piece is huge.
Sure.
Also a very small unit because we're only 4 procedure rooms. And so that little teamwork aspect is also huge in our department.
Awesome. Perfect. Thank you. And then I'll have Nikki and Emily talk again. This was about culture. If you guys just to give you
Yeah, we're a fast-paced unit. We work side by side with our neurology and neurosurge doctors. You get to know them really well. We also work a lot with speech therapy because we have a lot of patients who struggle with like swallowing. We also work with PT and OT. Our culture, it's very fast-paced, very teamwork oriented because we are one of the bigger units in the hospital. Everyone kind of knows each other. We do a lot of like fun events. We're a fun unit with very teamwork oriented.
Awesome. Okay. Anything you want to add, Nikki?
No, Emily kind of covered it. Yeah, she said we do have to rely on a lot of teamwork. We have to kind of make sure that we're talking with our care techs and, like she said, RT, speech, and different therapies, just to make sure that all of our patients are cared for properly throughout the day.
Sure.
So yeah.
Awesome. Well, good. All right, Marla, I have you next.
I would say the culture on 4 and 5 lead. I just always say we're just one big family. We have nurses that have been on the unit as little as 6 months, brand new nurses, and then we have all the way up to 43 years on the unit. So definitely have a wide range of experience, but I think that's perfect for a med-surg unit because they can lean on each other. They can ask those expert nurses questions, and they're great resources. But yeah, they work together really well. We work a lot with PT/OT as well with our ortho patients. Social work and care transitions are a huge part of our team as well with our discharges and figuring out safe discharge plans. So yeah, it's a great unit. Have strong leadership. My leads and supervisors have all been here 10 years or more as well. So they're just really great resources. So
Awesome. Thank you. All right. And then Kelly.
So neuro ICU culture is changing in that we had many nurses with 25 plus years of experience, and I've been there 14 years. Over the last 5, I've had many retirements from the unit, and then we added beds. So we have been hiring more newer nurses. But teamwork is the name of the game. I mean, it's what we have to do in order, sorry, dogs. It's what we have to do in order to get those 11 patients out and 11 patients in every day. So yeah, it's a good environment and great teamwork with our providers. They teach, they support, they help.
Awesome. Well, good. Well, thank you all for sharing. As Tara mentioned, we have about 4 minutes left. So instead of having us go round robin this time, I just wanted to kind of personalize it a little bit for Lisa on a last note and ask you guys kind of what makes your unit ideal for an experienced nurse. So obviously, Lisa mentioned she's been a nurse for quite a few years, but anything you guys want to add, I can just leave it open up to you guys to see what makes your unit good for an experienced nurse.
So I'll speak to neuro ICU. I mentioned briefly the relationship that we have with the providers, but to go into that a little more, we have each patient is admitted by a neuro intensivist, and that's their attending. We also have neurology and neurosurgery that are consults for those patients. Every one of those team members appreciates and supports our nursing staff. I keep them updated on staffing and how staffing is going, how many positions we have open. Right now, we are supplementing with some travelers because I cannot hire new grads anymore. I have enough of those. Need a little more support in the experienced nurse. But the doctors, again, are extremely approachable, and they really want to partner with our nurses in the care of the patients.
Awesome. Thank you, Kelly. Who else wants to share?
I kind of echo Kelly. A med-surg unit, of course, is we call them the feeder units, all new grads. A lot of them want to come to the med-surg units, which we love it and we appreciate it. It does kind of create that fun culture. but it is nice to have an experienced nurse as well that comes from either outside the organization or wants to go back into inpatient nursing, because you really are that person they can go to, not only for like nursing things, but also just that person to lean on. Like, you've been here, you've done it, you understand some of the hardships in nursing and how nursing used to be and how it is now. And you just have such a different perspective on just healthcare in general. And I think that's what I appreciate most about some of my tenured staff. They're like, oh yeah, back in the day, this is how, they've seen the changes and they understand that healthcare, it's always changing. And some of those newer nurses just need some reassurance that, yeah, it's changing and that's healthcare, but we've always gotten through it in the past. And so yeah, experienced nurses are always great to have on the unit.
Awesome. Perfect. Anyone else?
In the procedural realm, it's nice to have experienced nurses. We also do not hire new grads. We're thinking about introducing that, but it's really hard to be a new grad coming in because you are looking for those little changes. And when there is an emergency situation going on in the procedural realm, it's nice to have that experienced nurse to come in and be able to jump in and help out and take action to help that patient in those times of need.
Perfect. Thank you, Marcy. Well, Lisa, we have about 1 minute left. Any questions that you have for any of our nurse managers that spoke today, or anything for talent acquisition side or anything like that?
Are you guys looking more for a 12-hour, 3-day a week? Are these positions that are 5 days a week day shifts? Do you have call, especially like your procedure area? Do you take call for that area?
Yeah, endoscopy, we do 4 10-hour shifts, so 7 to 5:30, and full-time is 4 days a week, Monday through Friday, and then all the other hours are covered with call.
Okay.
For our neuro unit, we're at 3 12-hour shifts.
Mine as well.
All right. Thank you, ladies.
Awesome.
Thank you.
Thank you.
For chatting with us today. And Lisa, I appreciate it. Like I said, I'm glad you got the undivided attention that you needed for this. So thanks so much. And we'll see you guys back in the our next breakout room. So thanks so much.
Thanks.
Okay, Heidi.
Looks like Heidi is just now getting back from her breakout session. So you may
Okay, perfect.
All right.
Okay, if everybody's back from their breakout sessions, I am going to introduce Heidi Tawney. She's going to be presenting about medical surgical oncology.
Hi, good morning, everybody. I first of all just want to say thank you for being here. We're excited that you're here. When Ashley asked me to speak this morning, I didn't really know what to talk about. I could probably talk about oncology ad nauseum and why I enjoy working with my team. But this morning, I'm just going to highlight just how I got into nursing and just what my nursing journey has been about. I don't have control. Ashley, can you move me forward and to the next one? So before we get into my nursing journey, I thought it would be nice for you to understand just who I am as a person. I am the middle child of 3 girls. I'm very close with my family and feel very fortunate to have a very strong family that's supportive of me and supportive of what I love to do. I'm proudly from Minnesota. Anybody who knows me knows that I'm a diehard Vikings fan. And on any given Sunday, if the Gophers are playing Nebraska, I'm going to be cheering for my Golden Gophers and not the Huskers. I am an extroverted person. One of my passions is really connecting with people and getting to hear their stories and know them as people. And with my staff and what I do currently, I enjoy connecting people to help them grow and help them develop in whatever journey that they're currently on. When I'm not at the hospital, I enjoy traveling. The pandemic has stifled that a little bit, but I'm excited to get back out on the road. I enjoy baking and being an aunt. I have four little ones that call me aunt, and they're a true blessing. When I thought about other things that I really enjoy, I'm somebody that really enjoys the changing of the seasons, and so being able to come into fall and pretty soon we will have those first sprinkles of snow. I get really excited about things like that, and I think that it's just kind of a wonderful reminder of us that, you know, every chapter and every season kind of has to transition into something that's new. And then lastly, like I said, I really enjoy my friends and my family, and they're really, I feel very fortunate to have such a great support system. Growing up, I was always a science nerd, and I always knew that I would be in healthcare in some way. But it was never going to be in nursing. It was in my hometown, while not small, it's also not large. And the nurses that I knew worked in long-term care. And while that's a very wonderful environment to work in, I knew that wasn't something for me. So when I thought about what I wanted to do, I knew that I was going to be in healthcare, and I knew that at some point I would need to go on to more education. So Ashley, if you go to the next slide, that brought me to Northwestern. So after high school, I decided that, you know, the best way for me to kind of figure out what I wanted to do was to study biology, and biology was going to set me up for success in whatever realm of healthcare that I decided to go into. So I started at Northwestern College. It's in Orange City, Iowa, in the fall of 2001, and really started studying biology and had taken kind of that pre-med route. It was the way that I thought that I was going to be going, that I would figure it out and decide that I wanted to do medicine, and that was that. If you would have talked to me in college, I would have told you a myriad of things that I was going to do when I was an adult. You know, anything from teaching biology to, you know, to being a physical therapist or a doctor or, you know, a barista. I never really knew where that path was going to be for me. But one of the things that Northwestern always talked about was how to find your vocation. And we spent a lot of time, you know, thinking and like discussing, you know, what type of work we felt we were suited to do. Not to get all philosophical on a Saturday morning, but Aristotle says that vocation is where the needs of the world intersect with your talents. And I really feel like that is pretty indicative of kind of my nursing journey. And it's truly what led me to pursue nursing in the first place. So I have this love of people, I have this love of science, and I have a desire to serve and care for others. It's something that I feel like is innate in my personality, to be able to do that. So on a whim, and when I say on a whim, I applied for the accelerated program at Creighton University. I sent my application in. This was before it was online, and I sent it overnight to the university to get it in by the deadline. Thinking, okay, I'm just going to put this out there, and if I get accepted, I'll go to nursing school. If not, we'll figure something else out. And what I really found, I was accepted, and so when I started nursing school in the fall of 2005, I really was still apprehensive of nursing as a profession. I just really didn't have a great understanding of what nurses did, and really how they impact the healthcare arena. So, but one of the things that I really enjoyed about Creighton was it taught me how to care for others and how to love a hospital setting. So Creighton really takes a holistic, personal approach to healthcare, and that's something that really resonated with me as a person. I now, 15 years later, am back at Creighton, getting my executive MBA in their healthcare program there. So it's kind of coming full circle for me. Next slide, please. So when I thought about my nursing journey, like I really felt like my nursing journey started, I mean, yes, it started when I entered nursing school and decided that that's what I wanted to do. but I really didn't feel that like pull to nursing until my clinicals. And my clinical, my first semester, was fine. We did home health, or not home health, we did student health, and then we weren't in long-term care. And I knew that those weren't things that really excited my passion. But then I got into the hospital setting, and it was the first time that I felt truly like pulled into a space and into a space where I felt like that's where I needed to be. Throughout that, I ended up doing my preceptorship at Nebraska Medicine, and that's where my journey at Nebraska Medicine started. I remember walking in on my first day, and I was on the orthopedic floor, which is now the 9 trauma floor, if you're familiar with Nebraska Medicine, and just feeling like Nebraska Medicine had it put together. They supported their nurses. The nurses that I worked with enjoyed what they did, and they enjoyed working as a team. So that prompted me to apply to Nebraska Medicine. And so I started my very first job on September 25th, 2006, which last week I just celebrated my 15 years at the organization. And I started on the oncology hematology special care unit, which was the name of it is considered OSHU. And I really have enjoyed working. I really enjoyed working on that unit. I worked with really amazing expert nurses that had a desire to care for patients in a really compassionate way, that had a clinical expertise in the care of oncology patients, and that in that bone marrow transplant patient population. I was a lead nurse on that unit for 3 years, and truly enjoyed being on a unit that cared for people the way I had envisioned myself always caring for people. And really that set the foundation for the rest of my career going forward. I was at Nebraska Medicine prior to us having an electronic medical record. So I was able to take a step away from the bedside and help with that as a credentialed trainer for 6 months as we were transitioning to Epic. And through that, I got to interact with a lot of our physicians. I helped them learn how to transition their paper chemo orders into an electronic chemo orders, and really help develop that nursing workflow for that. That led me into case management. I worked with 2 lymphoma doctors for several years, working in the outpatient clinical setting and taking patients from the time of diagnosis all the way through, hopefully, survivorship. I really enjoyed that time in my life because you really got to see, and as a nurse, like really had a lot of input into what was happening for your patient. You were the person that they called when they had issues or concerns or questions. And you kind of got to be that expert lymphoma person and resource for these individuals. Next slide. After that, I went back inpatient to be into my formal nursing leadership role. And that took me to the opening of the cancer center, where I've been able to spend the last 5 years of my life opening and running our inpatient unit, along with a few other things. So the COVID pandemic took me away for just a little bit, but now we're back. Next slide. So this is what my career path has looked like at Nebraska Medicine. And I think if you would talk to a lot of people, this is what their career path will look like, and probably some of yours too. Next slide. You can go on. Next one. So why I chose Nebraska Medicine originally. So Nebraska Medicine, like I said, was a place that I felt very comfortable as a student nurse, and knew it was an organization that I wanted to work at. And it continues to be a great place for nurses to work. We value teamwork and autonomy, and try to really elevate the nursing profession. We talk a lot about working at the top of our license, and as leaders, we really try to work to promote our nurses working at the top of their license. We also work together to solve problems and to support each other. Our relationship-based care model really shows us that we, care for ourselves, care for our patients, and care for each other. So that's intertwined in all the work that we do. And I really do feel like the opportunities are endless. I've been able to do so many things in my career so far, and I wouldn't have been able to do them without the support of my leadership team. And now I get to give back to the nurses that I work on a daily basis. And it really does allow me to come to work every day and do the things that I love. Next slide. So why I love my job and why I love working on 8 Werner. So I get to work alongside some amazing people who showcase our I Teach values every day. We worked together to care for our patients, our families, and each other. You can't do your job without working together with your team. We have very high standards on our unit, and I think throughout the organization, and we really all have this desire to provide this high quality, compassionate care. And we have an ounce of fun in every shift. Not every shift is going to be sunshine and rainbows. That's healthcare. But if you can have fun and enjoy the people that you're working with and the job that you're doing, every day you'll come to work and have fun and enjoy what you do. In my current role, I get to help people grow and develop, which is really amazing. We, as our leaders here at Nebraska Medicine, we want our staff to learn and grow every day, and we want to help patients get to the point where they need to be. We get to meet patients in healthcare at a very challenging time in their life, sometimes their worst days, and the ability to come alongside them on their journey is truly a blessing, and something I think that all nurses really feel that draw to. And as the pandemic has kind of changed how healthcare is done, I think that we as nurses are in a really unique position to be a part of that reshaping of what healthcare is going to look like in the future. And that's something that I'm very excited about. And I hope that anybody that comes into our organization is excited about being a part of that reshaping of healthcare going forward. And I truly do think that nurses are going to lead that journey as we go forward. And then you can go to my last slide, Ashley. This is just a highlight of some of the amazing people I get to work alongside every day. My niece actually made that nice little Nebraska Medicine Strong picture at the bottom because she wants to be a nurse. And when I think about being inspired by and wanting to care for people every day, these are the people that are inspiring to me. So I hope that you got a glimpse into Nebraska Medicine and what it can provide you as a nurse. If you were like me and didn't think that you would end up in a nursing profession, that's okay. Own your journey, and it can be an amazing journey as well.
Thank you so much, Heidi. Thank you so much. I so appreciate you sharing your journey and what brought you to nursing. Okay. So now we're going to move into breakout session 2. Again, we're going to be going to learn more about different units and hear managers and supervisors talk about what makes their department unique.
And as we're moving into breakout rooms, if anyone is supposed to be in a breakout room and I didn't get you moved into there, let me know. It looks like people are still heading out into their rooms.
Tara, this is Meg. I'm not sure if I'm supposed to be in the same one as Melanie. I see Marla. I think we were in the same one.
Yeah, I thought I was supposed to be why Nebraska medicine, is that right? Meg, Melanie, and me.
Yeah, I was
That's-
supposed to
that's
be in
what
that
we're
one as well. And I think Denise Jordan as well.
That's session 3.
Oh, session 3.
Looks like we've got one of our attendees, Madhu, if you, it looks like you are assigned to one, but you just haven't joined one. So if you can click on the join breakout session, it will take you to your breakout session. All right, is there anyone in here right now that is supposed to be in one of the second sessions? If so, let me know which ones.
Kara, I think me, Meg are supposed to be in the why Nebraska medicine.
That is the third breakout session.
Third one.
Actually, so we're just in our second session right now. So we have 2 that are.
Oh, I get it. I'm
We
like,
have one
what?
that
I
is-
thought you meant like group number 3. Okay, so we don't do anything.
Yep, not for right now.
Okay.
I'm not sure which breakout group I'm supposed to be in, but I'm pretty sure I'm supposed to be in one for the emergency room.
Oh, I will move you
My
there.
group.
Thank you.
I'm not sure which one I'm supposed to be in. This is Emily on Neuro.
Okay. Neuro, I do not believe, no, Neuro does not have one for the second session. So just hang tight.
This is Mel, the PICU manager. Is there anybody here for PICU?
We have, I think he will be in with the ED NICU. Was that Mel Anderson?
Yeah.
All right, I will move you there. Thank you. And it looks like we still have Madhu Joshi. I'm not sure how to pronounce your name. I have you scheduled to go into a breakout session. If you're having technical difficulties, let me know and I can try and help you so that you can get into your ED NICU Women and Infant Services breakout session.
Tara, I think I'm supposed to be in with Melanie, and I think Marla is too. I
Okay.
think Ashley's waiting for us.
I will move you. You said, sorry, who needs to be in that room?
Marla Melgoza as well.
Okay, Marla and you said in the ED NICU, or I'm sorry, I don't know them off of people that are in them. You said Surge ICU? Trauma?
Wherever Melanie Tuamohaloa is and Ashley is.
Okay, all right. So Marla, you need to go, and then Meg, you need to go. Okay, there you go. Oh, and good. Our last registrant made it to their breakout session. anyone else needing to go to a room? These breakout sessions are very finicky when I have to manually create them, and I like to not send people to the right place. I'm going to take silence as a no and breathe a sigh of relief.
Good morning, Tara. This is Milagros. I was just wanting to double check. Do I need to be put into the room that I'm going to do the breakout session in?
Hi, Milagros. Not quite yet.
Okay.
We will be starting our third session shortly. We're still in our second session.
Perfect. I'll hang tight then. Thank you.
Thank you. Frank, welcome. You are muted, but we are still in our second breakout session. So you have got plenty of time. Thank you for logging on early. It makes it helpful for me when I'm assigning all the next breakouts.
Yeah, you're welcome. How's it going? Is it going well?
It's been going well so far. I haven't been in any of the breakouts. Sabrina, I don't know that you have audio to say.
Can you hear me?
Yes.
Oh, thank gosh. Yes, from what I got to hear back in my first session, it was going well. I think we had just a couple people, but I know there was a school that has Saturday classes, so they all signed up to get the recording anyway. So
good.
The benefit of Zoom is even if people don't attend, we still get their contact information to connect with them afterwards, which is a perk.
Great. Well, thank you all for doing this. I really appreciate it. I know it's taking a bit of your Saturday up, so thank you for doing that. Hey, Ada, how are you?
Hello, good morning.
Good morning, Ada. We are still in our second breakout session. That'll be ending in just a few minutes, but like I said to Frank, I appreciate you logging on early because it makes it easier for me when I schedule our next breakout session.
No problem. Yeah, I tell you what, I will be right back.
Sounds good. Ada, I'll just tell you about this. The tent arrived very early this morning for our second event at 9 a.m. I got a phone call. Hey, where do you want this tent? I didn't need the tent until 10:30. And fund services, I believe, is arriving between 10:30 and 11.
Okay. Do we have a stage too or no?
Yes, that is with the tent people.
Oh, okay. The hard part's done.
Yes.
If y'all didn't know, Tara is amazing. Just all the things.
She is.
Sometimes it doesn't feel that way when I'm trying to deal with this crazy Zoom breakout sessions, but thank you. Takes a lot of coffee.
I'm gonna grab more real quick.
We have an amazing team, so you all are doing fantastic. Morning, Milagros. How are you? Lee, how are you?
I clicked the wrong button. Good morning. I've had my cups of coffee. I'm ready to go. I'm excited to be part of this.
Be fun.
All right, I'm just about to close our second breakout session, and then we'll have Brandy Johansson give her presentation before our third breakout. So thank you, everyone.
Sure.
Welcome back. I think everybody's coming back from their breakout sessions. Okay, we'll give it just a couple more minutes and then we're gonna let Brandy Johansson and Sarah Swistak speak about their department and what they have to offer from 5 West. Everybody should be back from their sessions. So if Brandy and Sarah would like to get started, we would love to hear from you.
Awesome. Ashley, can you hear me?
I can. Thank you.
Perfect. Perfect. Hi, everybody. So first off, as Heidi said, thank you so much, everybody, for joining us today. We're so excited to talk about Nebraska medicine and all the amazing things we have to offer. So I'm going to specifically talk about 5 West, our unit. I'm going to first open up and kind of talk about just a small glimmer in my journey. And then I'm going to have Sarah talk about what her journey has been too, up into taking on the NPDS role. So as I said, I'm Brandy Johansson. I'm the nursing manager for 5 West. So I started at Nebraska Medicine as a brand new graduate nurse as well, just like Heidi. I also started in 2006. So I also have 15 years of experience at Nebraska Medicine. Started as a brand new grad, like I said. I worked nights for 6 years. I was a lead nurse on nights for about 3 years. And then I was the associate nurse manager on 5 West as well for about 3 years. And now I've been manager of 5 West for a little over 4 years. I am a med-surg nurse at heart. I can imagine myself doing nothing else than med-surg nursing. I have a strong passion for med-surg nursing. Love what I do. I love the med-surg life. I love getting to know patients and all those things. I also have my master's in nursing education. I got that in 2018. I love new nurses. I love to teach. Sorry, my cat keeps jumping up here. So that's kind of my little bit of journey. So I'm going to let Sarah tell hers.
All right. Can everybody hear me? Hello.
Yep, Sarah,
Yes,
I can hear you.
There we go. All right. Hi, everybody. My name is Sarah Swistak. I am the nursing professional development specialist for 5 West. My journey started on 5 West as well, back in 2011, I believe. I was a CNA on 5 West for 4 years while I was going through nursing school at UNMC. I then took a staff nurse role on 5 West. I was a nurse out on the unit for 6 years. I did various things in that staff nurse role, including the relief TL, UBC chair, and sat on many of the hospitals' shared governance councils. I also love med-surg. I feel like there's just so much to learn at that med-surg stage. And I love our ability to be able to take the time to get to know our patients and their families and really get them set up for success to go home. Because I love teaching, I always was the first one to sign up for students, new nurses. So when the opportunity presented itself this spring for me to step into the professional development role, I jumped on that opportunity. So I've been in this role about 6 months and I am loving it. I love being able to teach new nurses that come into the organization, as well as continue to work with the staff on 5 West to help them grow and develop in their careers and their journeys.
All right, Ashley, can you go on to the next slide? Thank you. So I'm just going to briefly touch on our leadership team on 5 West. So our director, her name is Angie Best. She's amazing. We all have a great relationship with her. She rounds on the unit a ton. She checks on us. She's just an amazing person. So obviously I'm Brandy, I'm the nursing manager. And then we also have 3 nurse supervisors. So Diane, Emily, and Michelle. We have 1 day shift supervisor and 2 night shift supervisors. Their role really is kind of just an extension of me. They are leaders on the unit. They are there when I'm not there to answer questions, provide support, all those things. And all 3 of them are just awesome. We also have 1 staff nurse lead. Her name is Taylor. And then obviously Sarah are in PDS. We also have a 5 West administrative senior assistant. Her name is Laura. She's kind of the person you really want to get to know because she helps get you paid every day. So she is just a really, once again, an extension of me and Sarah, kind of our right-hand woman. We also have a medical director. We have a really great relationship with our medical director. His name's Dr. Bunham. He's, once again, kind of like Angie. He checks on us all the time. He buys food for the unit. He is just an amazing doctor and a great support for our staff. Go on to the next one. So just want to kind of give you a 5 West unit overview. So our unit has kind of went through a very unique journey over the past 2 years with COVID. So I'm going to first talk about what 5 West normally is, and then I'm going to talk about what 5 West currently is. So 5 West, as I talked about, we're kind of just that everything unit. So we take all adult medical surgical patients. We have 33 to 38 beds. We do have semi-private rooms, so that's why I say 33 to 38 beds. And we have telemetry capability for every bed. Something very unique about 5 West as well, we have a centralized nurses station. We are very much a teamwork oriented unit, and I think that has a lot to do with our centralized nurses station. Our team, as Heidi talked about her team, we laugh, we get to know each other on a personal level, talk about what they did over the weekend. And that's just a really fun part of our unit as a centralized nurses station. So talking about kind of patients that we take care of. So a lot of CHF, respiratory issues, COPD, asthma exacerbations, pneumonias, sepsis. Sepsis is actually our #1 DRG that we take care of on 5 West. We see a lot of bowel obstructions, liver and kidney failure, diabetes. About 75% of our patients on any given day are diabetic. So we take care of a lot of diabetic patients. Psychiatric illnesses, so bipolar, schizophrenia. We do see some suicide attempts of patients. So a little bit more of those psychiatric illnesses. 5 West does take care of 2 specific populations that only come to our unit. One is the bariatric surgery population. So these are patients that come in for a gastric bypass or a gastric sleeve. And then we also take care of cystic fibrosis patients. So I'm sure you guys can read there, though. These patients are just so fun to take care of. And currently we're not able to because we are a COVID unit. They're currently over on 8 Warner, but we really miss these patients because we get to know them on a very personal level. When they come in, they're here for about 2 to 3 weeks at a time. So we get to know their families, their kids, their parents, their dogs, their cats, just a really fun population to take care of. On to the next slide. So I'm going to briefly talk about what our journey is currently right now. So we became a COVID unit back in March of 2020. So we've been doing this for a little over 18 months. So we were asked to care for the patients on the med-surg side of COVID. So we take care of COVID positive patients and COVID rule out patients. What's really unique and different about COVID is obviously COVID doesn't care who you are. It affects anybody and everybody. So we take care of completely patients that have no comorbidities, and then we take care of patients that have lots of comorbidities. So, patients just like in that previous slide with CHF, with diabetes, with hypertension. We've had an LVAD patient on our floor, patients that maybe came in with a heart attack, but they're COVID positive, they come to our unit. A patient that maybe had a motor vehicle accident, but they were positive, they come to our unit. So anybody that comes in COVID positive that doesn't need ICU level of care, they'll come to our unit. So we care for patients with very high amounts of oxygen demands. So this was something very new for our unit, to learn the different oxygen devices that maybe we had never had before. So one thing we do care for is patients on OptiFlow. And those patients can sometimes be on anywhere from like 40 to 60 liters of oxygen. So very high oxygen demands. So that was, like I talked about, very different for our team. And they had to go through some education to learn those devices and how to run the device. We have a great relationship with our respiratory therapists, get to work really closely with them. So PPE practices on 5 West for the COVID patients. So we were N95 masks, face shields and goggles, gown and gloves. So at the beginning of COVID, we did have to extend the use of our N95 masks. So we did a process where we actually cleaned our N95 masks. We are no longer having to do that. Something I've always said, I'm so proud to work at Nebraska Medicine. We have never had a case where we didn't have enough PPE to do our job. And now we have enough or an adequate amount of supply of N95 masks that we actually don't have to extend the use of them anymore. So we're currently in our 3rd wave of COVID. We actually did have a little break from COVID this summer. We went about 3 months with no COVID patients, but unfortunately in August, our numbers started to creep up again. So we are, like I said, once again, a full COVID unit and have been for pretty close, like I said, 18 months. Go on to the next slide. So some experiences that you'll see on 5 West. So medications and devices. So cardiac drips, we see a lot of nitro, especially with COVID. We've had a lot of nitro, cardizem, and EMU. Sometimes these patients come in with heart issues, and we actually see probably more of these devices with COVID than with non-COVID. So that's been really interesting and unique for our staff to see those. So some high alert drips that we care for, insulin and heparin. So especially with our COVID patients, I'm sure most of you know blood clots and PEs are COVID patients are very prone to these. So we have anywhere from 5 to 8 heparin drips on our unit on any given day. Also with patients with COVID, they all have to usually be on Decadron to help with the COVID symptoms. So we see a lot of insulin drips and a lot of just giving sub-Q insulin as well. So tubes and drains, we see central lines, we see PICC lines, ports, all of those things, indwelling urinary catheters as well. We see wound vacs, abscess drains, GP drains, and then I already talked about the high flow oxygen devices. So each shift consists of a nurse supervisor and or a team lead. So our nurse to patient ratios are 4 to 5 on days and 5 to 6 on nights. That's pretty typical. But I always tell people we have to adjust the staffing needs of the organization as well. So for example, if 6 and 7 lead is maybe got very much more high acuity patients and they need more help over there, we'll send a nurse over to them to help them, and vice versa. Maybe we have more high acuity patients on our floor. So our organization really works together to care for all patients on all units. And then talking about our CNAs, we have some amazing CNAs on our unit to help our nurses out. So highly trained, highly accountable, and their ratios are about 6 to 8 on days and 8 to 10 on nights. Our 5 West leadership team is just very, very hands-on, and we have a very open door policy. Me and Sarah, we like to come in scrubs every single day. We just want to get out there and help wherever we can. And then we also like to help with resume building, interviewing, and applying for school. All right, I'm going to let Sarah go now.
All right. So like Brandy said, we're a centralized nurses station. You can see that there in our pictures. Teamwork makes the dream work. We hear that a lot on our unit. We are known throughout the organization as the Wolf Pack. There's a story behind it. I don't know it anymore, but somebody somewhere came up with the Wolf Pack and it's stuck and it's never gone anywhere. We are very big on helping one another, and we really pride ourselves on that. We have very high quality standards on our unit. We've gone, I don't even know, Brandy, how long have we gone without a CAUTI?
2.5 years.
2.5 years. So we pride ourselves on our quality data. We are big on innovation. We are getting ready to pilot a care pair CNA pilot where we pair one nurse to one CNA and see if those two together can, what the patient ratio could go up to for that nurse, given that dedicated CNA. This is one of the innovative tasks that we're trying to do in order to help with this nursing shortage. We have a very strong relationship with our ancillary and provider teams. Their offices are right down the hallway. Our respiratory therapists are amazing. When we got the OptiFlow, they came and they'll train and teach as needed. When we get trach patients, they come out and they are very hands-on in helping our nurses learn and feel comfortable with the various things. We love having students. I currently have 2 different nursing student cohort groups on our floor, as well as 4 preceptor students on our unit. So all of our nurses, not just Brandy and I, enjoy teaching, and we just jump at the opportunity to enrich students' lives with what med-surg really is and how great it actually can be. Next slide, please. So I'm going to talk a little bit about orientation for new nurses, and this is pretty typical across the organization. So for new grad nurses, we are typically around that 6 to 8 week mark of orientation. For those coming in with experience, it can be around 5 to 6 weeks of orientation. We also have our new graduate nurses go through the nurse residency program, which you'll learn from Kaylee later. And that's the end of my time.
Did you guys
Oh, sorry. Yes,
want
last
to
slide.
say anything about
Just
scheduling?
kidding. Yeah, so sorry, I froze. Yeah, so scheduling on 5 West, we hire straight days and straight nights for new grads. We also offer shift rotation scheduling as well upon request. Full-time employees are required to work 3 shifts of weekends every schedule period. And then Nebraska Medicine has their holiday teams.
Thank you so much, Brandy and Sarah. I really appreciate you sharing all that valuable information. Okay, so now we're going to be moving into our 3rd breakout sessions. We are so excited to get to learn more about our values and culture, diversity and inclusion, growth and development, and benefits.
Morning.
Good morning.
Do you pronounce it Ada?
That's right, Ada.
Perfect. I'm Sarah. I work on the talent acquisition team with Sabrina and Christy. We haven't officially met, but it's so nice to see you.
Nice to see you all.
Are you in the office?
Yeah, we get our own time to talk to you.
Yeah, right. Yes, I am in the office. So I have a simultaneous event right now that I'm going to scurry to as soon as this is over.
Geez, it's busy.
I was just going to ask, I heard you guys talking about that earlier. What other event do you have?
So it's called The Power of Prevention. It's a vaccine pop-up that we're also organizing in conjunction with the North Omaha Community Care Council. And so like Power 106 is there. We have like giant Jenga, we have food trucks, we have just all the things. And then Douglas County has all 3 vaccines. And so.
Cool.
So you're a little busy today.
Just a little bit.
Well, we have a school that they have Saturday classes. So we're still doing the recording to send out to everyone so we can still do intro and hear about you and our diversity and inclusion programs here.
Wonderful. Well, I'm so glad that I was invited to be here this morning. The concept of diversity and inclusion is really, I think, top of mind for many. I like to couch it though in the terms of belonging. The work that we're doing in the diversity and inclusion subunit is really about creating spaces where our workforce and our patients feel like they belong in this space. We do incredible work here at Nebraska Medicine. And when we say we practice, serious medicine and offer extraordinary care, we really mean it. And part of that is really ensuring that we see one another. And that's really what diversity, equity, inclusion, and belonging is all about. I started here at Nebraska Medicine in June, and we've hit the ground running since my arrival. We are really highlighting individual identity. So this past month, we honored Hispanic Heritage Month. October is LGBTQ History Month and National Coming Out Day. So we have programming around that. And the National Coming Out Day is something that Nebraska Medicine has done for years. We have a program called Come Out for Cookies, where we show our advocacy, allyship, and support for the LGBTQ+ population. And then we're prepping for Native American Heritage Month, which is in November. And so we constantly are thinking about how we affirm the individual experiences of our workforce. And it's not just their programming, like that's just one aspect of it. We also have something called employee resource groups. And these are spaces where employees can come and talk about the issues that are impacting them the most within both Nebraska Medicine, but also within our region, our state, and our world. And so we have the African American and Black Alliance, we have the Emerging Professionals Alliance, and the LGBTQ+ Employee Alliance. So that's just the beginning, though. I will say we are I would say months away from launching our veterans and military affiliated families employee resource group. And we are very close to our women's leadership employee resource group. And there's more where there's space to grow. So we are absolutely emerging in our journey. There's so many ways to get engaged and involved in DEI efforts and initiatives. I just hired a new director of engagement, outreach, and belonging, and this person is working directly with our workforce to ensure that, again, this sense of belonging isn't something that we just say, it's something that we believe, it's something that we practice, it's something that we feel every day.
Mhm.
That would be, you know, my thoughts around DEI. I have a really open door policy. So hopefully with this recording, my information is shared. So if folks have questions and want to follow up and have one-on-one conversations, please know that I'm a resource for that as well.
Awesome. I also, Ada, I wanted to talk, I want to hear about more of your background. And obviously I know you just joined us and can you tell us a little bit about like your previous experience, where you came from, how you like Nebraska so far?
Sure. So I am originally from Boone, North Carolina.
Okay.
I am from the South, and I lived all of my life in the South. So I went to UNC Chapel Hill for undergrad and law school. I practiced law for a few years and then transitioned into the diversity space in higher education. So really helping college students think about how they show up as their authentic selves. As I progressed in my career, I realized that there are really niche industries where we can see transformation occur more swiftly. And there are two areas I thought most about are healthcare and law. Law because I'm an attorney, but health equity is huge. And the work that healthcare workers do to enhance the lives of people is just, it's mind-blowing to me because I'm not a clinician, right? And so when I walk into Nebraska medicine every day, I'm like, I can't believe I work here. Like I am honored and humbled. Like we perform miracles every day. So anyway, I am enjoying getting to know Omaha. I like to say I'm eating my way through Omaha. I have found some of the best restaurants. Last week I had Ethiopian food. I went and had pupusas. I went to J Coco, which is like American fare. I like just the variety of food that my partner and I can have is just mind blowing. So when you ask how I'm enjoying Omaha, I'm absolutely loving it. So this has just been an incredible transition. The 4 months have flown by, but it has flown by in the best of ways. And so a lot of my family members have asked me, like, how has it been moving to the Midwest from the South? How has it been coming to Omaha? And in fact, my aunt came to visit me and we are just driving down Farnham Street and driving past the med center. And she looks over at me and she said, Ada, I love it here. And she had only been there for 15 minutes. And I said, I know, Auntie, I had the same reaction. And so long story short, we're loving it.
Good. I'm so glad. I know, I'm sure it probably was a change, but that's my hands down favorite aspect about Omaha is all the food. Like there's so many different options. There's new restaurants that pop up all the time.
Yes.
But you can literally get any type of food that you want here. And it's great.
It's so good. And we're only scratching the surface.
Yeah. So. Well, good. Well, so I wanted to also ask you a little more about, so I know you just kind of touched on and obviously you, like you said, you definitely hit the ground running when you first started here and everything. So next steps in moving forward, you kind of mentioned that your plan, or you might have some more employee resource groups. So I wanted to kind of touch a little more on those. How did those kind of like come to fruition and stuff?
Sure. So the 3 employee resource groups that we currently have existed prior to my tenure. So that, again, that speaks volumes to Nebraska Medicine's commitment to equity and inclusion. These are truly teams of employees who said, you know what, we want to come together and talk about the issues that are concerning us the most. And so, for example, our African American and Black Alliance has about 90 members. They have
awesome.
It's huge. They have a very active, what we would call a channel on our intranet page. And they are constantly placing or posting information about historical context, whether it relates to the African American diaspora, the African diaspora, or other ethnicities or lived experiences. There, it's a very inclusive group, so you will find just a wealth of experiences within what we call ABBA. And I'm really proud of the work that they've been able to do. Similarly, the LGBTQ plus Employee Alliance is incredibly active. It is a joint partnership with the University of Nebraska Medical Center. And so we call that UNMC. And that group, similar to ABBA, actually that particular ERG was one of the first ERGs and has been just paving the way for inclusion within our organization, from programming to advocacy to talking through what it means to show up as an ally. This past summer, the LGBTQ plus Employee Alliance organized our presence at the Omaha Pride Parade. And I mean, it was just incredible within my first few weeks to be a part of that. And so when I think about our ERGs, our employee resource groups, they really do show up for not only one another, but for the entire organization.
That's awesome. Good. I'm trying to think about what else.
Where is your office located? Where are you on campus?
I'm in Kiewit Tower, the 3rd floor of Kiewit. And so ambulatory vice presidents are on this floor as well. Many of the acute care directors and vice presidents are on this floor as well. So it's a good space for me, especially to learn more about Nebraska medicine and to see the wide variety of clinical and non-clinical practices that we have.
Are you comfortable talking about how people can join these resource groups that we have?
Oh, absolutely.
Here too.
So as soon as someone joins our team at Nebraska Medicine, they can join an ERG. And they could also reach out and shape one, that if there's an ERG that appears to be missing from our list. What's exciting about our ERG framework is that it comes with a budget. So we're able to resource and support the work of our ERGs financially. And so they're able to host programs and events, both for the medical center and also for the community. So it's as simple as filling out a form and saying, hey, raising your hand and saying, hey, I want to be a part of it.
Awesome. I love that. I know, so with talent acquisition and your team as well, so that's stuff that we are currently working on as well to make it more like for the groups and everything to be get active in them more right away, because a lot of times employees just don't know that like upfront and everything. So I know we've talked about like the roadmap that our employees will have too. So including like the different groups that we have to talk about it and just like everything that we're doing so people don't miss out on it.
That's right. And I think what I appreciate about our ERG structure is a lot of it is self-driven and self-motivated. So you could be president, or you could come to meetings once a month, or you could come to just programs, right? There's no pressure to have to perform or do more. It's just show up authentically as you. And I really appreciate that.
Yeah, that's a good point too. I'm part of the emerging professionals one too. So it's something that I got involved right away, but then I was like, okay, what do I do? Like, should I go to the events, or like, is it something I want to be like super a part of and stuff? But they've been like, so, they're always welcoming. And then they have a lot of, since we've had a lot over Zoom, it's, I'll be honest, it's a lot easier to join some of the like breakouts. We talked about like stress and burnout and one of the groups. And the last one we had actually last week was about fitness. Fitness at home is also important.
Yes.
So we've kind of tailored it to the Zoom world and everything too, which I think is good for all of the groups to be able to get everyone kind of on page and everything too. So
absolutely. And I think it's a strategic way to build community. When I think about our intranet page, and we call it the Now page, and when someone posts something, to see your community show up and like it or put a positive comment, it just feels good. And then to see them at an ERG meeting, you feel like, okay, I'm coming into this space every single day, but I'm seen, and you can see me, you can see the things that matter to me, and I can again be authentically Ada Catherine Wilson every time I step foot. And that community is something that is sometimes challenging when we're in a virtual setting, especially if we're not able to engage outside of these walls in the ways we would normally be able to.
Yeah.
So.
Awesome. Well, good. Well, anything else that you can think, Ada, to add? We can definitely wrap up a little bit early if you need to get going to your next event too. So
I had a question. I know we've done some events already, and obviously the one you have today, but are there any in like the future that are coming up that you're excited about, or we should be aware of too, that's even in the community or just with Nebraska Medicine and UNMC?
You mean in terms of events? I would say that I am looking forward to American Indian Heritage Month that's coming up, and there are several community-based events that will be a part of that as well. And so the theme for the month is We Are Still Here. And so having American Indian scholars come and speak about what it means to be a part of the Native American, American Indian tribal nations within Nebraska. I think that is such a great way, for us to showcase how we show up every day. When Shonda Ross, who is the new director of recruitment, outreach, and engagement, I'm not, what am I talking about? Engagement, outreach, and belonging, not recruitment. But she's going to be creating a calendar of programs and events. And so I'll make sure that she is empowered to share that with you all so that you can be present as well.
Awesome.
Cool.
See it.
Yay.
Anything else that you guys can think of?
That's kind of it. It's nice to finally meet you.
And in a smaller setting.
Yeah.
Right. No, this worked out exactly how it was supposed to. And I'm so thrilled to have time with you. And again, if you would like to set up separate time or anything, just let me know. Open door.
Awesome. Yeah, our talent acquisition team was definitely very excited when you were first coming on, but I think we were a little too excited because we wanted to grab you right away, but a lot going on when you first started. But yeah, this has been super great. So thanks so much. We'll go ahead and wrap up, and then of course people can, like you mentioned, reach out if they have more specific questions when they do this presentation too. So
wonderful. Well, y'all have a great day. It was so good to
awesome.
see you.
Thanks, Ada.
Thanks
Have a
for
great
inviting
day.
me. Okay,
Thanks.
bye.
Bye.
That was good. She's so nice.
She is so nice.
I think if we leave, it'll take